Hi, it's Mel from Ultimate OSCE and I'm here today to talk about nursing problems. The best way to watch this video is to have a blank care plan with you. So if you've already applied to do the OSCE, your Nile, Blackboard, Moodle, you can download a care plan off one of those. Or if you've not applied for your OSCE yet, if you're on Facebook, I'll just attach a PDF blank care plan below. If you're on WhatsApp, obviously you've got one already. If you're on YouTube, I'm sorry, I'm not able to attach a PDF to YouTube, so you'll have to WhatsApp me. Okay, I'll leave the number there for you. Okay, so nursing problems. So if you look at your blank care plan, the top section is nursing problem. Okay, so if you are used to using a nursing diagnosis, it is fine to put a nursing diagnosis in this section. If, however, you've never heard of nursing diagnosis and you have never used one before, lots of nurses hasn't, it's not time to start learning now. It's a very complicated taxonomy to learn. You don't need it. All you need to do is to write a simple nursing problem for the NMC OSCE, okay? And that's what we're going to talk about today, just simple nursing problems. So what is a nursing problem? A nursing problem is not a medical diagnosis and it shouldn't really be concerned with the disease process either. It's more about the patient's experience, okay? I'm just going to flip this chart. So, I've written on the top here, this top section, a problem the patient is experiencing. So, to write a good patient problem, nursing problem, sorry, it's not only a problem the patient is experiencing, but it should also be a problem that we as nurses can either minimise or resolve. So, for example, if you've got nursing problems such as pain, such as active bleeding, such as acute nausea, they're all problems that we as nurses can complete nursing interventions to either minimise or resolve. Okay, so those are good nursing problems to write in your OSCE care plan. If you look at the bottom section, hopefully you can see on your smartphone, it says or at risk of experiencing. So it might not be the nursing problems that you identify in your assessment. So for example, in your assessment you might see that the patient's in pain, they might tell you that they've had a recent falls history, they can't walk properly, they need a walking aid, and you think, oh right, okay, so maybe they're at risk of having a fall. Or it could be that they're about to have surgery, and please note, listen very carefully, in the NMC OSCE time can move. So if you have a pre-operative patient in your assessment station, read the scenario very carefully when you move into planning, because you might be writing a post-operative care plan. So although the patient wasn't at risk of infection, so the patient due to surgery is now at risk of infection or is at risk of hemorrhaging. So nursing problems are about the patient's experience, okay? It's not a medical diagnosis, and that is the one group of nursing problems. There's also another group. Okay, so I don't know if you can read this. It says a patient's inability to complete an activity of daily living. So this is the next group of nursing problems that you can use when completing your nursing care plan. So if you don't know about Roper's activities of daily living, now's a good time to learn, because it is used in the NMC OSCE. So when you hit the NMC assessment station, you're meant to ask questions about the patient's ability to complete certain activities of daily living, and with that information, if you find that your patient has a self-care deficit and they're not able to complete activities daily living, such as they're not able to safely mobilise or they have difficulty in breathing, these are really relevant to your patient, okay? And they're relevant problems, and you can certainly write about them in your nursing care plan, okay? Now, I have to tell you about priority problems, okay? There are various different groups of patients you meet in the NMC OSCE, okay? Because the NMC OSCE is assessing your competence in caring for all sorts of patients that you nurse in the UK. So you could have a rehabilitating community patient, or you could have an acutely unwell hospital patient that's just come into hospital, or they're, as I said before, they are going to have an operation and you're going to have to write a care plan for post-operative care. So if you have a patient that is acutely unwell, or they're about to have surgery, or just come into hospital, then they're not very well and you need to prioritise the care you give. So you need to write priority nursing problems for this patient, okay? So in a nutshell, put simply, priority problems are problems that are going to kill a patient first, okay? So it's an easy way to remember. So for example, if you've got, in assessment, you've got a little old lady that's confused, and she needs a walking aid, and she's fallen over at home, she's at high risk of falls, she's not able to mobilise properly, so that will be a priority for her. Or if you've got a patient that has difficulty in breathing, is not able to maintain their oxygen saturations, that's a priority for them. Or again, as I said before, if they're surgical and they're at risk of infection due to the insult of surgery, writing a risk of infection problem is priority for them. And also, please note, pain is considered a priority problem. It's a lot of literature around, and there's a certain big push in with NICE and the NHS to prevent patient pain, because pain can really adversely affect outcomes for patients. So pain's a priority problem as well. But what isn't a priority problem is problems such as anxiety due to being hospitalised, or they have a knowledge deficit about how to look after their wound, or they have got weight loss. These aren't priority problems, okay? So they're fine for some groups of patients, but if you have an acutely unwell hospital patient that's just come into hospital or is just recovering from surgery, please use priority problems, okay, in your nursing care plan. So we've talked about just about the priority problems for acutely unwell patients, but as I said, nursing in the UK, you look after a big group of patients, and some are being rehabilitated or they're already in the community, and so priority problems aren't really appropriate for them. Instead, we have to focus on the patient's experience, because we are, as nurses, helping the patient to be as independent as possible and supporting them with being able to manage their own care. Okay, so the nursing problems are very different for these patients. So, for example, a patient not understanding their medications, having a knowledge deficit about how to look after themselves or manage their condition is a very appropriate problem. Or how to manage their own pain, or how to manage, I don't know, a long-term catheter, or if they've had recent weight loss, or if they are feeling anxious or anything. That's considered an appropriate problem for this group of patients, and it's appropriate to put it there. You don't have to put a priority problem for this group of patients. You're more thinking about how you are going to assist that patient with managing their own care and supporting them with that. Okay. I hope you have found this useful. This is just a little introduction to how to write a nursing problem. If you found it useful, or you know anyone that is about to see the NMC OSCE, would like to know about this, please tag them in. And I look forward to talking to you soon, okay? Bye.